It may feel as though you and your family are stuck in a cycle of never-ending illness this time of the year. Those colds come and they're a little bit more severe than usual, or you have one of those coughs that seems to linger a lot longer than it should, which can be concerning. Well, Dr. Justin Skrzynski joins us now in studio to explain why that cold may not be going away and also some of the things that you can start to do now to feel better. Thank you for being here with us.
My pleasure, thank you.
So I know a lot of people seem to get sick around this time of the year. That is a common thing.
Absolutely, absolutely. This is we're entering our peak respiratory season right now. So it's kind of the common players. You think about the three big ones you hear about: COVID, influenza, RSV. Those are the big ones. But there's sort of a whole host of respiratory viruses that are in the background as well.
Yeah, and I know there's a lot of factors that contribute to some of that, especially with it being the holiday season as well. A lot of people gathering. What are some of the reasons that we see such an uptick?
Yeah, for exactly the reason you said. So cold weather forces us indoors, closer proximity. That's really the main thing. So the main way that these things are transmitted person to person. So coughs, sneezes, even just talking, things of that nature.
Okay, and I know a lot of times we'll have a little sniffle because it's a lot colder outside. How do you know the difference between it being something not as serious or something where you maybe need to seek medical help?
Yeah, and that's a big question, because now with the weather being as it is, allergies, molds, those things can be common too. So, if a lot of people can kind of sense when they have that sort of viral syndrome, fevers, chills, those do not go with seasonal environmental changes. That's more like a cold. So, if you have concerns, go get tested. Think for things like flu, COVID. That's a wise choice.
Okay, and what are some of the reasons that those symptoms sometimes don't want to go away?
Yeah. So unfortunately, after an illness, you can have post-infectious syndromes. So you can have a cough, you can have sniffles. That can last for days or even weeks. If you're not getting better or you're getting worse, that might be a sign that there's another infection developing. So sometimes we get hit back to back with those things. So just be mindful of that.
Okay, and in being mindful, any clear ways or signs that we can spot the difference to know that it could be something happening like that, what you just mentioned?
Yeah, so again, things like, fever, shortness of breath, those typically don't go along with kind of just the cold weather sniffles that we have. And if you're somebody that has a chronic illness or respiratory illness, those people especially should be really mindful of those symptoms.
Okay, and I know a lot of times people still come to work with the sniffles, just trying to make sure we're getting things done. But that's also one of the ways we can stop the spread. Any other things we can keep in mind as far as prevention?
Yeah, so as you mentioned, staying home when you're sick, that's a big one. Some people don't have that luxury. I know it's very controversial, but masks do work. So if you have to go out, a good fitting mask. Also hand hygiene, always a staple of staying healthy.
Okay, anything else that people just need to know just in terms of their overall health, especially in this season?
Yeah, so try and stay on a routine. It's easy to lose sleep. It's easy to get off your kind of normal pattern of mobility and exercise and diet, and those things can deplete your immune system. So the best way not to get sick is to go into this season as healthy as you can be.
All right, definitely want you to stay healthy out there. Thank you so much for your time.
My pleasure, thank you.